Hello, everyone, and welcome. It is my pleasure to welcome you today to Susan G. Komen's virtual Metastatic Breast Cancer Impact Series event. My name is Gina Chicatel, and I am the Manager of Mission Education for Susan G. Komen. The programming for the MBC Impact Series is envisioned as a year-long conversation with attendees, presenting new information and speakers each month. Today, our topic is brain metastases and quality of life. Our featured speakers are Dr. Sarah Sammons with special guest Dr. Jennifer Nosker, and our fantastic moderator is Julia Hughes, an MBC advocate. Before we begin, Komen would like to thank our sponsors for supporting the 2025 MBC Impact Series. So thank you to our premier sponsors, AstraZeneca, Gilead, and Merck, and our signature sponsors, Daiichi Sankyo and Novartis. This series is made possible because of their generosity, so thank you to them. So one more housekeeping note, while our speakers are talking, please feel free to post your questions in the Q&A feature in Zoom. It should be in the lower panel of options on your screen there, and we will get to as many as we can at the end of the presentation. But please remember, our speakers are not able to provide individual medical advice, so keep your questions as general as possible. Towards the end of our program, a survey link will be placed in the chat, and your feedback is very important to us and helpful for future MBC program planning. This is where we get a variety of the topics that we present on throughout the years from your feedback. So now I am excited for all of you joining us for today's discussion. And to start, I would like to introduce you to our moderator, Ms. Julia Hughes. So for over 9 years, Julia has bravely faced the challenges of living with metastatic breast cancer, starting from her diagnosis in 2015. With a deep personal commitment to breast cancer advocacy, she possesses exceptional skills in communication, organization, and fostering community support. At Komen, she plays a pivotal role in addressing the needs of the MBC community, ensuring that diverse voices and perspectives are heard. Despite the unexpected stage 2 diagnosis in February 2015 and the grim prognosis that later came that June, doctors foresaw only 6 months to live, but Julia's unwavering faith has propelled her through the tumultuous journey of treatments and surgeries. Enduring over 55 IV chemotherapies, brain surgery, double hip surgery, and ongoing oral medications, her resilience stands as a testament to the strength she derives from her faith. Her dedication extends beyond personal battles. Julia actively fundraises for Komen Hawaii, leading a top-ranking team and generating vital funds since 2015. As a sought-after speaker, she has graced the stages of the Susan G. Komen Pink Tie Ball in 2019, 2023, and 2024, inspiring audiences with her story of resilience. Recognized for her remarkable advocacy, she received the More Than Pink Inspirational Award in Hawaii and was featured prominently in Generations magazine, including the cover, so you go girl, raising awareness of breast cancer across all age groups. In 2023, Julia's passion for advocacy reached new heights as she successfully campaigned for Honolulu's mayor to proclaim October 13th as Metastatic Breast Cancer Awareness Day. Her influence continues to grow as she serves on our Metastatic Breast Cancer Steering Committee since 2022, eagerly anticipating further opportunities for impactful service. In tandem with her official advocacy responsibilities, Julia aims to bolster her presence on social media, delve into book writing, and forge partnerships with local charitable organizations. Outside of her advocacy work, Julia finds immense joy in her roles as a wife of over 14 years, a mother to 2 young men in their early 20s, still can't believe that, and a devoted pet parent. She cherishes precious moments with her loved ones, indulges in creative crafts, travels to visit family, finds fulfillment in exercise classes and outdoor adventures, enjoys mini vacays, delights in culinary experiences, finds solace in church and Bible time, immerses herself in reading, and embraces every aspect of life with gratitude and enthusiasm. Guided by her faith, her mission is to live each day according to God's plan, thriving in every moment. And with that, I will hand it over to Julia.
Wow, Gina, thank you so much. That was a lot. So thank you for having me here. I'm happy to be the moderator today. And yes, brain mets and quality of life is a very important topic to me as it's very personal. I did have brain surgery and gamma knife radiation about 5 years ago. So I'm always eager to learn new information myself and find out what the path is for all of us as we journey along and do this together. So I'm very excited to be able to help us answer questions and hear from our esteemed doctors today. So thank you so much for having me. I'd like to introduce, first of all, Dr. Sarah Salmons. Sorry, Dr. Sarah Salmons. Dr. Sarah Salmons is an associate clinician at Dana-Farber Cancer Institute in Boston, Massachusetts, and faculty member of Harvard Medical School. Her clinical focus is in the treatment of all stages of breast cancer. Dr. Salmons completed her fellowship in medical oncology and hematology at Duke University Hospital. In 2018, she joined the staff of Duke Cancer Institute and served as Associate Director of Breast Cancer Research. She joined Brigham and Women's and Dana-Farber Cancer Institute in 2022, where she serves as an Associate Director of the Metastatic Breast Cancer Program. She is interested in developing novel systemic therapies to improve outcomes for patients facing breast cancer. We also have with us today Dr. Jennifer Nosker. Dr. Jennifer Nosker is clinical neuropsychologist who specializes in the assessment of cognition in brain tumor survivors to optimize overall well-being. She joined faculty at Brigham and Women's Hospital, Harvard Medical School in October of 2024, where she currently provides neuropsychology services in 2 clinics, conducts research on cognition and brain tumor survivors, and provides supervision to neuropsychology trainees. Welcome.
Hello, everyone. So happy to be here. Thank you for having me. This is a topic that is very near and dear to my heart, and so I'm happy to be here and talk about it. Usually, I'm asked to talk about, the treatment of breast cancer brain metastases, and not as much about the quality of life impacts of having brain metastasis, which is equally important. And so we're here today to have a discussion about that. And I asked my colleague, Dr. Nosker, to come along because I just felt like she could add some absolute valuable information for anybody out there listening. So today we'll discuss the treatments for brain metastasis because I think it's relevant to understand the treatments, to understand also how each treatment might impact your quality of life, because it's not only the brain metastasis that impact quality of life, it's actually the treatments that we give to patients to help them live longer that can also impact quality of life. And then, of course, we can identify the problem, but what's the point if we can't help strategize on some solutions on how patients might be able to improve their quality of life and live to the best of their ability with an MBC diagnosis. So first and foremost, having brain metastasis, which is when breast cancer spreads to the brain, is actually a lot more common than people understand. It's probably not something that people talk about or warn everybody with MBC about because it's scary to think about and it's scary to talk about, but it's actually fairly common. In hormone receptor positive breast cancer, about 15% of patients will develop them. But in triple negative and HER2 positive brain metastatic breast cancer, around 40% of patients will ultimately develop a brain metastasis, so not uncommon. One of the controversial areas in the field is that we don't screen everybody's brain with brain MRIs all the time. We tend to only do a brain MRI in patients if they're having neurologic symptoms. And there's a lot of controversy in the field as to whether or not we should be doing that and if doing that would improve outcomes. I think it probably would, but in medicine, we always need to do studies to prove that an intervention can help patients in the long run, and those studies are underway. But once a patient develops a brain metastasis, there are local therapy options, which the goal of those local therapy options are to either eliminate or reduce the size of the brain metastasis, controlling the disease in the brain so that the tumor in the brain, of course, cannot continue to grow and spread and cause more side effects, more symptoms, more, long-term difficulties for the patient. Some patients might be recommended to have surgery to remove the brain tumor. And that is sometimes considered if a brain metastasis is very large, if it's in an area where it's causing a lot of swelling or it's pushing on some brain structures that are causing, the patient a lot of symptoms, or if there's just one single area, sometimes surgery will be recommended. Also, sometimes there's swelling in that area even after radiation, and we're not sure if the brain metastasis is progressing or if it's swelling related to radiation. And then sometimes in that case, surgery will be recommended as well. I would say surgery is less often recommended than radiation. Radiation, obviously, it uses essentially X-ray beams to treat cells that are growing and kill those cells. And it's not invasive, meaning that you don't have to have a surgery to do it, but what doesn't mean that there are not side effects. There are two different types of radiation. There's stereotactic radiosurgery, which is very focal radiation just to the brain tumor and slightly around, encapsulating the area around the tumor. And then there's whole brain radiation, which is radiation to the whole brain, exactly what it sounds like. Then also more and more, and every year we are developing new drugs or systemic therapies that have improved penetration and ability to get into the brain to treat brain metastasis. And so systemic therapies or drugs are also becoming a major way that we can help treat brain metastases. So, we treat brain metastasis with the goal, of course, of improving symptoms, preventing the time until the brain metastasis grows in the brain, preventing the time until a new brain metastasis happens, prolonging survival. And all of those outcomes and metrics are important. But in doing that, what we don't talk enough about and what we're going to focus on today is how those treatments impact the patient and how having brain metastasis can dramatically impact quality of life and what we can do. So first, I'm going to start by just some of the common side effects, just naming them, because I think naming things and educating patients about what they might be experiencing is helpful. And then we can talk about some strategies to help you. So whole brain radiation is generally recommended when a patient has many brain metastases. And that is radiation to the whole brain, as I mentioned. And there are certainly some short-term and long-term side effects that can happen with whole brain radiation. One of the most common ones that I see in my practice is fatigue. And this can, persist for weeks or months after treatment. Many times patients are then put on systemic therapies, and systemic therapies have a main side effect of fatigue. And so fatigue is really something that a lot of my patients struggle with. With whole brain radiation, hair loss is also possible. For most patients, it can be temporary, but for some, it can be permanent. And so that is certainly something that can be distressing. Both a symptom of brain metastasis, many patients who have brain metastasis, one of the first reasons that we know is because they're having headaches. And then they tell their team, and then their team orders a brain MRI. So headaches are a common symptom of brain metastasis, but they can also occur after treatment of brain metastasis as well. And this can also happen because sometimes there can be a little bit of swelling in the brain metastasis after radiation. One of the most challenging complications of having brain metastasis and having treatment for brain metastasis is the cognitive changes that occur. And this is why I'm bringing in Dr. Nosker, because she is truly the expert in this place. But oftentimes after radiation, patients can experience memory problems, difficulty concentrating, difficulty with executive memory function, problem solving, things like that can become a major issue. Dr. Nosker, what are some of the main cognitive changes that you see in patients after whole brain? Is it okay if I ask you that?
Absolutely, yeah. Often memory is an area that's affected. And I'm not sure if there is an echo on your end. Is there an echo on your end that you're hearing right now? No,
You sound
okay.
pretty good to me. Yeah.
All right, just double checking. Thanks. So
Yeah.
memory is in fact affected, but also speed of thinking. So patients will often feel that things are just taking a little bit longer to process. Information's taking longer to learn, and then even just more difficult to get ideas out. Attention is also very common too, almost similar to having ADHD, where you might be a little bit more distractible and a little bit harder to focus as well.
Yes, thank you. I definitely have patients that have noticed that. Hearing changes are also a possibility, and all of these are not in everyone. These are all just possible. Hearing changes are possible. Also, neurologic symptoms more focused on the physical area. So depending on where the brain metastasis was, sometimes patients can have weakness or balance issues, particularly if the brain metastasis was in an area of the brain called the cerebellum, which is intimately involved in our balance and how we remain not dizzy all the time. Patients can notice things like that. And, just a more global impact is just interference with life. So interference with abilities of doing daily living, housework, general work, things like that can be impacted. And all of these are things that we see from time to time. Stereotactic radiosurgery, which is more focal radiation. In general, stereotactic radiosurgery has less impact of quality of life and less side effect burden than whole brain radiation. However, I will say I absolutely still have patients that have long-term challenges who have had stereotactic radiosurgery, particularly if they've had multiple brain metastasis radiated or if the areas that they have had radiated are larger areas. Fatigue is still absolutely possible. Headaches are possible. Neurologic changes depending on the area of the brain treated. Patients might experience temporary or less commonly permanent changes in neurologic function, such as weakness, sensory changes, balance issues. Hair loss in the focal area that was radiated is possible. I also want to talk a little bit about radiation necrosis, because as a brain metastasis expert, that is something that I think about all the time, but it is not something that the lay person or even the metastatic breast cancer community, I feel like talks or thinks about a lot. And it is very common and it's becoming more common. So radiation necrosis is a potential complication of mostly stereotactic radiosurgery, so the more focal radiosurgery. And it's, basically a complication of just we treat the area with radiation that effectively eradicates the tumor in the vast majority of cases. But what can happen is that the tumor and the healthy brain tissue around it can be slightly damaged and become necrotic and inflamed in that area. And it certainly can cause symptoms and it can cause cognitive changes depending on the area that the radiation necrosis location is in. And sometimes in brain metastasis, it's hard to know if a previously treated brain metastasis is actually getting worse or if it's just inflammation from radiation. And sometimes we'll have to do surgery or a biopsy in that case, or a trial of steroids to be able to tell. But generally, your radiation oncology team with your medical oncologist can help determine the best course of action there. I just wanted to go over a little bit about neurologic basics, neuroanatomy basics. I always have to refresh my memory of this. And to become a doctor, I had to go to 14 years of school. And, I've been an attending for almost 10 years now. But our brain is such an intimately sophisticated, beautiful organ. And the side effects that you have from your brain metastasis or from the radiation used to treat your brain metastasis or surgery are going to be highly dependent on the area where that brain metastasis happened, because all of these places in our brain do different things. For instance, if you look at number 1 in the occipital lobe, that is the visual area that is in charge of sight, image recognition, image perception. You have a brain metastasis and treatment in that location or surgery, you may have visual side effects, symptoms because of that. If you have a brain metastasis in area 4, which is Broca's area, that can impact the muscles of speech. So you may have challenges getting out words or syllables that you didn't have trouble getting out before. Area 5 is the auditory area. So that area could impact hearing. The cerebellum is that small area. It's almost like a small ball, area 14. The cerebellum is intimately related in motor function, coordination of movement. The foot goes before the leg, the hip moves along with it. Balance and equilibrium and posture are intimately impacted by that area. And that's a very common place for breast cancer brain metastasis. And so the more surgery or radiation that you've had in that areas, you may have impacts. And so the side effects or symptoms that you have are very intimately related on where your brain metastasis was. And I think that is important to understand a little bit. So how can brain metastasis impact quality of life? Well, they can impact quality of life a lot. And whether it's from the brain metastasis itself or the treatment, people's overall quality of life impact is highly variable. Some people don't have any impact on their quality of life. And some people have dramatic impacts on their quality of life. And that is unique to every patient. And it is highly variable. And it's going to be based on the number of brain metastasis, the size, the type of therapy that you've had, the location of the metastasis, and also the overall health of the individual. So some people are impacted greatly, and those are the people that need the most help. Some people, we just radiate a really small lesion and they're not impacted at all. And so very different, very individualized. In terms of neurologic symptoms that patients might experience, it could be a range of neurologic symptoms. Headaches are possible. Seizures are possible, which can be managed with anti-seizure medication. Weakness in the arm, the leg, the facial muscles, depending on the area of the brain metastasis. Balance issue, changes in vision or speech are possible, but again, all highly individualized. Cognitive impairment is also possible. Patients can experience memory problems, difficulty concentrating, issues with their ability to work, manage daily tasks, executive functioning, things like that. One thing that I didn't mention is that whole brain radiation, brain metastasis, having metastatic breast cancer in general can cause a range of emotional and psychological impacts that I think are incredibly important for us to think about. Depression and anxiety are very common complications of both metastatic breast cancer and brain metastasis, and whole brain radiation is actually a risk factor for depression in many, many patients. And so it's really important that your team look at the whole person and understand if depression or anxiety could be impacting you in any way and what are the steps that we can take to improve that. Fatigue is oh so common. So no shame, no guilt if you have fatigue. That is very common, and sometimes it can be quite impactful. And sometimes just a functional decline, meaning that before I had brain metastasis, I could walk 4 miles, I could clean my whole house, I could watch my 3 kids, and now I can still do a lot of those things, but I need to take more breaks. I need a nap here or there. I need to write things down where I didn't have to write them down before. A bit of a decline is possible as well. So how do we best analyze how brain metastasis and their treatments have impacted a patient? Well, I'm going to talk a little bit about my medical assessment. And then I'd like Dr. Nosker to talk a little bit about what kind of neurocognitive or neuropsychological assessment does she do to really understand how brain metastases have impacted patients as well. So for me, I talk to the patient. I do a history, a physical. They tell me, well, I had radiation. Now I'm not having trouble hearing in this ear. My balance is off. I'm doing a neurologic exam. That only gets us so far, though. Certainly, if a patient is having impacts on their hearing or their vision, I'll send them for an ophthalmology exam. I'll send them to an ENT for an auditory examination. If they're having issues with weakness in a certain area, I might send them for physical therapy or occupational therapy evaluations. That's definitely not getting into the nitty-gritty of executive functioning. How is my short-term memory? How is my ability for word finding? And so I'd love if Dr. Nosker could just tell us a little bit about some of the assessments that she can do in brain metastasis patients.
Oh, thanks, Dr. Salmons. Yeah, so when I meet with a patient, what I do is I, of course, review their medical record. I want to know what what her medical workup looks like and the clinical picture of the patient, what they've experienced, what treatments they've had. But in the clinical interview, I'll ask a lot about some of the questions that Dr. Salmons already said. So I'll find out, are you working right now or are you retired? And that certainly, some people's symptoms might be more prominent if they're working, if they're raising kids, if they have a lot more demands, their symptoms might be more noticeable versus someone who's perhaps retired and maybe their symptoms aren't as noticeable because they're able to do one task at a time and clean the house and then do the laundry and things like that. But I'll still ask about all those sorts of things and if there's been a change, and that's what we're really looking for. But I also ask about sleep. How's your sleep? How's your mood? And because all of these factors as well can impact cognition too. So we don't only have the brain metastasis itself, the treatments, whether it's hormone suppression, whether it's chemotherapies, radiation, we also have just the effects of mood and how that affects cognition, fatigue, that affects cognition. And so I ask a lot of those questions as well. And then after I have an idea of the main concerns that a patient has and also how the evaluation could be most helpful, then I'll give a battery of tests. And what that is paper and pencil tests without poking, without prodding. And I look at things like attention, higher order thinking skills, like executive functioning. When you think of executive functioning, it's like an executive behind a desk, organizing, planning, doing kind of multitasking, these harder skills. I look at memory, different aspects of memory, as Dr. Salmons has already referred to. Memory has 3 parts. It's being able to learn and take things in, hold on to it, and bring it out when you need it. And that's executive memory difficulties, is the bringing it out when you need it. And many patients do tend to have some difficulties with that. And so we also assess language skills, visual spatial skills to get a pattern of strengths and weaknesses. And if there's areas of weaknesses, then we can identify what we could potentially do and how we can support the patient. And we tend to optimize areas of strengths to help with that. And so a neuropsychological evaluation is certainly looking at cognition, all the factors that can affect cognition, as well as next steps and what we can do to support patients moving forward in their own goals, whatever that is.
Thank you so much. Yes, it's a very comprehensive evaluation. And I know that particularly for my patients that have a fairly high symptom burden, it can be very helpful. So let's talk a little bit about we've identified that without a doubt, brain metastasis impact quality of life. But let's talk a little bit about some of those quality of life impacts and some strategies that patients can take to improve them. So fatigue is so distressing to patients, but as Dr. Nosker just mentioned, fatigue also and poor sleep also impact cognition and also can lead to mood changes like depression, anxiety. So it's sort of all intertwined. So I do think that fatigue and making sure that you're getting plenty of rest is incredibly important in the context of all of this. So for anybody with fatigue, what are we thinking about? We want to ensure that the patients are getting proper sleep. And if they're not, we're talking to them about sleep hygiene, making sure they're not eating or drinking an hour before bed. You can just Google sleep hygiene, but it's basically, we are also attached to our screens, making sure that we don't have screens in front of us, any blue light in front of us for at least an hour before bed, no eating or drinking an hour before bed, making sure that you're in a nice, dark, quiet place to sleep, all things like that. Also making sure that in the confines of a day, if you are feeling tired, that you do plan a little bit of time to rest. If you are fatigued and, you have more, understanding what points of the day that you have the most energy in, and then trying to use that time to do what's most important. So it takes a little bit more planning of your day, but doing that can be important. One thing that has been shown in cancer-related fatigue to actually improve the fatigue is a regular exercise regimen. So exercising 3 to 4 times a week with regular interval exercise, not just, well, I'm active, I'm always up and about. That doesn't count. It's actually getting out there, walking for 30 to 40 minutes, doing an actual exercise regimen has been shown to help. I know that can be hard, but it is shown to be helpful. Mind-body practices like Qigong, Tai Chi, and yoga have been found to reduce fatigue in people with cancer. At this time, there's no medication that has been shown to help with cancer-related fatigue, but I know that one day there will be, and my patients will really enjoy that. Anything to add here, Dr. Nosker?
Yeah, the only
There's
thing to add
Yeah.
is pacing. And you already alluded to this, but what I often tell patients that I see is to pace yourself if you're able to do that. And so that consists of prioritizing things that need to get done and also things you want to do, and then letting the other things that you can either offload or that don't need to be done today to let those go to the next day. And then taking breaks throughout, just because if you push your body and your mind to the point where you're completely taxed, then it's going to be a little bit harder to recover. So you want to give yourself some time in between things to rest up.
Great. So another thing that I wanted to talk about is depression or anxiety. Extremely common in really all breast cancer patients, not even just metastatic breast cancer patients or patients with breast cancer brain metastasis, but very common for anybody facing such a life-changing diagnosis, and absolutely nothing to have shame about. In terms of identifying it and talking about it is one of the most important things. So symptoms or signs of depression or low mood would be, I should ask Dr. Nosker, but putting my medical school hat back on, poor sleep, poor eating, something called anhedonia, which is, I used to really enjoy doing these things. Now I don't really enjoy doing anything. What else am I missing that could be signs of depression?
Some people may just feel kind of sad, kind of down, not their normal kind of happy, peppy self. Other people
Yeah.
may veer towards sadness. They may veer towards irritability and
Yeah.
anger. They just might have a lower threshold for stress, so that maybe things used to not stress them out. Now they're getting upset pretty easily. Those can be some signs.
That is a great point. I have had patients come in and say, I am just snapping at my husband and my children, and that was never me before. And that can definitely be a sign or a symptom of depression. So those are some of the things to look out for. You know, anxiety is excessive worry. I'm not able to fall asleep at night because I'm thinking about, you know, all of the terrible things that are going on, panic attacks, things like that. So another very good, you know, helpful remedy for depression and anxiety is a regular exercise regimen. That's not going to cut it for a lot of people though. So we definitely recommend exercise, but I also recommend therapy, which is called cognitive behavioral therapy. So seeing, you know, asking your doctor for a referral, or many times you don't even need a referral from a doctor anymore, you know, to reach out to a therapist, a social worker, to start doing regular counseling sessions. Because even if you don't think this diagnosis is impacting you, it probably is. And just having an hour a week or every other week to just, you know, talk about it and talk about strategies to move forward in a healthy and productive way, I think can be very helpful. I think getting outside is really important. I am new to Boston in the last couple of years since 2022, and I have noticed both in my patients and myself that the lack of sunshine in the winter really impacts me. And I think it impacts my patients as well. I think it's really important to get some degree of sunlight during the day. Fight isolation, even though you might want to be alone. Um, you know, having strong relationships and strong bonds with those around you is very important in overcoming this. And palliative care can be very helpful if you are a spiritual or religious person. Spirituality can also be really helpful to patients. And then, of course, not listed here are medications. Sometimes all of these things are being done, and you know, mood is still an issue. Medications, we usually start with something called an SSRI, a Lexapro, a Prozac, something like that. We can go beyond that, you know, depending on the severity. Medications are also an integral part of this. Anything I'm missing here? Or any other thoughts?
Yeah, the only other things that I would add to it is that everyone's going to have an emotional reaction to cancer, to brain metastases. And so, you know, if you're experiencing any of these symptoms, you don't have to be necessary, you don't have to have a diagnosis even to see someone. You can just see someone, you can just get that support. And, you know, where we get even more concerned is when the worry or the sad mood is happening more often than not. And you're just, if you're finding yourself in that place, that's definitely when we want to get supports on board. And the research really says a combination of therapy as well as medication have the best effects for patients. And what I often tell my patients, I am not a prescriber, but when they are seeing someone and when I'm having conversations about potential options and who they could see to follow up with, I'll often share with my patients that just like insulin is used for diabetes, antidepressants or medications for depression and mood is just like that. It's just basically supporting your brain's neurochemistry while you're doing therapy to just help you feel a little bit better. It is certainly not something negative about you. It is nothing to be ashamed about. It's just your brain adjusting to all of these changes and everything that's happening. And getting a medication on board for a little bit of time can just balance things out and make things just a little bit easier.
Absolutely. Couldn't agree more. Neurocognitive changes. So this is one of the largest challenges that I see my patients face after brain metastasis, either surgery or radiation. You know, they will come in and they will say, my short-term memory is just not where it was. I can't remember anything. I can't, unless I write it down, I cannot remember. I'm having trouble getting out words that I wasn't having trouble getting out anymore. What would you say to those patients? How do you counsel them?
Yeah, I think that's a really good question. You know, often what I find, at least from, from my perspective in an evaluation, I always want to know what's driving things. So again, if people often experience memory difficulties, but it's usually not even memory per se, it may be attention. Attention's the gateway to memory. If you can't focus on something, it's never going to get in to begin with. So as I find out and kind of parsing apart what may be driving some of the difficulties, then it's looking at what can we do about them. And so often, there's different approaches to this. There's compensatory strategies, and then there's also strategies to try to recover abilities. And both of those things can be done just through little things you can implement during your day. Like I'll tell patients, okay, if you're struggling to come up with a word and word retrieval difficulties is a main issue, then what you don't want to do is basically perseverate on that word and sit on that word. Just describe the word, like, oh, what is that? I'm trying to say water bottle. That's something I drink with. It's for water. And you can kind of move on with the conversation by just describing things about the word to kind of jog your memory, or using a synonym, and not just as an example of some strategies that I'll give in our evaluations of how you can kind of get around some of these weaknesses. Because often when people experience them, then they're very distressing. And then there'll be a focus on the symptoms, and then that makes it even worse. And so coming up with strategies to help, but also giving patients a little bit of reprieve so they're not so stressed about it as well, can help alleviate things too.
Do you find lists are helpful, or, memory cues? Is there anything like that you talk to patients about?
Yeah, that's a really great question. So I firmly believe in structured supports. And so the more routine you can establish in your home and in your daily life, the more prompts that you can use to help jog your memory, the more systems you can get in place, the more things become automatic. So I often recommend people to have a pretty structured routine in terms of their medications, things like that, so they don't forget. But also
Like
for
pill boxes?
exactly. Yep. Have
Alarm.
structured routine. Yep. Yep. Pill boxes, and maybe it's next to the coffee machine because you always have your coffee. So you pair it and kind of use these mind games a little bit, structuring techniques to prompt you. I'm a firm believer in calendars. I actually don't like using digital calendars. Some people do, so that's great. Everyone's brain's different. But even having a calendar of either to-do lists or appointments in a common living area that you can just, as you walk by, you see it, oh yeah, I need to do that, versus you having to constantly come up with things, and a working list of tasks that you've got on the refrigerator, things like this. One more thing I'll add on briefly, certainly because there's a lot more, but I'm a firm believer in a memory journal. And a memory journal is something that you can keep on your person at all times. So you can put it in your purse, you keep it in the same spot in your house all the time. And so you always know where it is, and you never have to worry about losing it or forgetting about it. And more that becomes routine, you can have a section to write to-dos in that too. You can have dates of what you did that day, conversations you've had. And it's also kind of a neat memory journal where you can reflect and look back what you've done and special moments you've had throughout your day. And it's kind of a nice journaling activity while also keeping on track of responsibilities and things.
Absolutely. Those are some really nice touches. And then just another pretty common complication that I'll talk about is, dependent on the area where the brain metastasis was, there could certainly be some motor or physical deficiencies that patients could have. A little bit of gait instability, which is trouble walking or shuffling walking, or not feeling as steady walking as you were before. Maybe you're, weaker in one area more than the other. And I do feel that physical therapy and occupational therapy can be really helpful in trying to help patients overcome some of these challenges. I know that you have recommended PT and OT for some of my patients in the past, Dr. Nosker. Would you agree that it can be helpful?
Very much so. Very, very much so. Yeah.
Okay. So I think at this point, we have 15 minutes left. And so with that, I'd like to take some questions. Let's see. Julia, are you going to help us moderate the Q&A?
Yes. First, I'd like to
Okay.
say thank you so much for this great presentation. I've had brain mets for 5 years, and I think this webinars should be a must for anyone going through this. I cannot believe how much information you've provided me and how heard I feel and how validated I feel, because you've highlighted so many areas where I've questioned and wondered about, and I seldom would get answers or kind of get brushed off a little bit. And it's made me feel somewhat normal, I guess, if that's an acceptable word these days. But I just thank you. You guys are a fantastic team. I took a ridiculous amount of notes, and I'm going to rewatch this because I thank you. Just know that my thanks is just like right up here. And I hope that everyone feels the same way, because it's been fantastic. So yes, there are a few questions. One is, what are the most effective systemic meds for brain mets?
Very good question. I knew I wasn't going to get by without talking a little bit about the systemic treatments for brain metastases. Well, it's highly dependent on the breast cancer subtype. And so it really depends. I would say for HER2 positive metastatic breast cancer with brain metastasis, our two most effective therapies are a tyrosine kinase inhibitor called tucatinib that is generally given with capecitabine and trastuzumab, that has shown very good outcomes for patients with HER2 positive brain metastasis. Also, what we're learning is that antibody drug conjugates seem to get into the brain and have better activity in brain metastasis than historical just regular chemotherapy. So the antibody drug conjugate, trastuzumab deruxtecan or Enhertu, has pretty excellent activity in the brain, both for HER2 positive patients and patients whose tumors express low levels of HER2. For estrogen receptor positive patients, if patients are still what we consider to be endocrine sensitive, they have not progressed on, multiple lines of endocrine therapies. Endocrine therapy with either an aromatase inhibitor or fulvestrant with a CDK4/6 inhibitor, generally either Verzenio or Kisqali, has shown pretty excellent brain control after radiation. The oral chemotherapy capecitabine has shown some nice activity as well, or Xeloda. And there's some newer antibody drug conjugates coming down the line, datopotamab deruxtecan, which likely has pretty excellent efficacy. So a lot more to come. We have a lot more work to do in this space, but we're seeing more promising results for systemic therapies in the brain in the last 5 years than we've ever seen before. And I'm really optimistic.
Excellent. Oh, how long is radiation active in your body after treatment is finished?
That would be a good question for a radiation oncologist. Radiation is generally very quick acting. When you get radiation to a brain lesion, sometimes it's just one treatment. Sometimes it's one very quick treatment over 3 days. If it's whole brain radiation, usually it's every day for 10 days. But it's very, very short acting. So it's not that the radiation necessarily stays in your body, but the impact of radiation is long lasting. So radiation is very effective in treating the brain metastases that are present. The problem is, and where systemic therapies come in, are it can treat the area, radiation treats the area that it's treating, but the risk is developing new brain metastasis in other areas, which is actually an even greater risk than the area that's been radiated growing. And so I hope that answers the question. It's not that radiation stays in your body, but the impacts of radiation are long lasting. And radiation does control the area radiated for quite a long time.
Thank you. Another question from a guest, what are the most commonly prescribed treatments for depression for a patient with brain metastasis? You may have covered that, but was there anything else you'd like to add?
I would say, because I am a prescriber, we don't send everybody to psychiatry. There's a national shortage of psychiatrists. It's actually very hard to get into one. So we're often, prescribing depression medications. The treatment is not so different than anybody else with depression. So first line treatment is generally something called an SSRI, or serotonin selective reuptake inhibitor, which is, something like a Lexapro or a Prozac or a Celexa. That's generally first line. If patient's depression is, still pretty severe after, you escalate the dose of those medications and they're doing all of the other things, they're doing therapy and exercising and all of that, then it might be time to phone a friend and have them see a psychiatrist for some more support.
Thank you. Another question from a guest: is there a blood test to show brain mets?
So that's a really good question. And the short answer to that is maybe, but it's not ready for prime time. When you're talking about blood tests for cancer detection, you're talking about something called circulating tumor DNA. And so circulating tumor DNA is that tumors, regular, organs in our body, cells are constantly dying. And when they die, they shed their DNA into our bloodstream, and you can detect those through a blood test. We're pretty good at detecting circulating tumor DNA for tumors outside of the brain. For tumors inside of the brain, when there's no cancer outside of the brain, this is coming from the primary brain tumor data like glioblastoma, astrocytoma, things like that. They can detect circulating tumor DNA only about 50% of the time. What's probably more promising is trying to detect circulating tumor DNA in the cerebrospinal fluid, which is the fluid that sort of surrounds the brain. And so there are some studies that have shown that that might be the way to actually detect something, is not by looking in the blood, but in the cerebrospinal fluid. But then that would require patients to have lumbar punctures, and most patients don't want to have lumbar punctures. So there's more research ongoing. I think when blood tests get more sensitive, it's going to be more of a possibility.
Okay. Since you mentioned that brain mets is a possibility when you're in metastatic breast cancer, how do you know when to inquire about brain mets if you've already been battling metastatic breast cancer?
Yeah, it's a good question. So, the American guidelines actually are different than the European guidelines. In Europe, the European guidelines actually say that patients with HER2 positive metastatic breast cancer or triple negative breast cancer should probably be screened at least once a year for brain metastasis. The American NCCN guidelines say that there's not enough data to recommend that at this time. I think for my patients with HER2 positive or triple negative breast cancer, they have somewhere around a 40% chance of developing brain metastasis. That's almost 1 in 2. That's 2. That's 4, 2 in 5. So that's not a negligible number. And everybody has a headache once a year. So I try to do my best to ask them specifically, are you having any headaches? Have you noticed any change in your memory? Have you noticed any change in your vision? If you've been having headaches, are they more increased frequency? Are they increasing in their severity? And if the answer is yes, then I order a brain MRI. But the problem is we can't just order things nowadays. We have to get insurance to cover them. So generally, if you're having a headache, if you're having any neurologic symptom, you should tell your team and they should be ordering a brain MRI.
Thank you. Can chemotherapy and radiation be given simultaneously?
Yes, they can. It depends on the chemotherapy and it depends on the type of radiation. So just best to ask your medical team dependent on the type of radiation you're getting and the type of treatment that you're having.
Thank you. I just realized the time, and I'm wondering if we have to wrap it up. Gina, is it timed for our closing remarks, or do we have time for one more question? Okay, one more question. How common is leptomeningeal cancer in HER positive patients? I'm not familiar with that.
Great question. So leptomeningeal disease is when breast cancer spreads into the meninges, which is the outer covering of the brain. And the fluid that is within the ventricle system of our brain and surrounds the spinal cord. And leptomeningeal disease is really probably one of the most difficult, challenging entities to treat within metastatic breast cancer. It is probably occurs in somewhere around 10 to 12% of patients with HER2 positive metastatic breast cancer. So we do see it a fair amount, and there still are treatment options. And there's more and more every year.
Thank you, both of you. Doctors, do you have any closing remarks before we hand it back over to Gina?
My closing remark would just be that in patients with brain metastasis in general, we work very much as a multidisciplinary team. You know, I'm a medical oncologist and I focus on, you know, the systemic treatments and kind of the overall care, but we are highly reliant also on our radiation oncologists, sometimes our palliative care specialists. If you're lucky enough to have a Dr. Nosker, you know, we work, our mental health professionals, we work very much as a team. And the more wraparound efforts, the more wraparound supports that patients can have, I think the better the outcome, the better the experience. And so just form a good team around you.
And my last comments would be if you are having cognitive symptoms and you want to get it checked out, tell your oncologist and they can refer you to a neuropsychologist that's hopefully on your team. And if not, they could potentially even just refer you to a speech therapist who does cognitive rehab, and they can do their own examination and brief evaluation and actually do cognitive rehab with you as well to get some of those skills back too. So just know there's options for you and supports out there.
Wonderful. Thank you so much, ladies.
Thank you.
Gina?
Thank you.
All right, coming back on to bring us home and take us out. I'm so excited that all of our participants could be here to join us for this important event. I wanted to express our sincere gratitude to our speakers today, Dr. Sarah Sammons, Dr. Jennifer Nosker, and our moderator, Julia Hughes. Today's session was recorded and it will be posted on our NBCIS landing page very soon, so you can rewatch this session or view any previous sessions that you may have missed. Please help us spread the word about these important events and the content with your friends, family, and healthcare professionals. And you can visit our landing page to sign up for our events or our NBC newsletter to stay informed. And you can do that at komen.org/MBC series. That'll take you directly to our landing page. Once again, we want to acknowledge our sponsors for the 2025 NBC Impact Series. Their generous support allows us to continue to offer this sort of content and bring our community together to share important information, resources, and experiences. So thank you to our premier sponsors, AstraZeneca, Merck, and Gilead, and then our signature sponsors, Daiichi Sankyo and Novartis. Please also help us by completing our survey for this event. You will find the link in the chat. We'll also mail it out to you in email. But your feedback is very, very important to us and so super helpful as we determine what topics we're going to feature throughout the rest of the year. Finally, the next event for the NBC Impact Series will be on July 15th and is focused on the metastatic breast cancer research updates that came from the recent American Society of Clinical Oncology annual meeting that wrapped up earlier this month. So once again, thank you to our sponsors, thank you to our speakers and our moderators. We're so happy you could join us today. We will see you all next time.